Welcome to Neighborhood Update. We have decided to focus the next few shows on the coronavirus epidemic, as it is what is on the minds of all of us, as we learn to deal with what is being called the new normal. It is impacting every part of our lives, and hopefully the conversation and information shared will help you with some of your questions and concerns. To guide the conversation with me today is our Director of Public Health, Damon Chaplin.
Good afternoon.
And Director of the New Bedford Health Center, Cheryl Bartlett.
Good afternoon.
Welcome to both of you.
Thank you.
So let's get right into it. I can only imagine how taxed both of you are right now, and I personally would like to express my thanks to the medical community for all the hard work that you all are doing to keep us all safe. That's so hugely important. Damon, I will begin with you. At a recent press conference, you relayed that there were no incidences of COVID-19 in the city of New Bedford. What is the snapshot today? Where are we?
Yeah, it's consistent. We have no confirmed cases of coronavirus in New Bedford. There are 5 confirmed cases in Bristol County. We do have 2 persons under self-quarantine, and then they're waiting for their quarantine period. We're waiting to see if they become symptomatic over the next 14 days. But as of right now, we do not have any confirmed cases of COVID in New Bedford.
Speak about your position and your responsibilities as the Director of Public Health for the City of New Bedford in terms of the changes week to week that we find in how we move about the city, where we can go or can't go. Is that stemming from your office, and how are you navigating this for us?
Yeah, and so it's a coordinated effort between state and local health departments, also with state and local government, and then our community partners, Community Health Center, South Coast. In a large part, the health department becomes a convener and collaborator of partners in helping bring folks together with services and skills to address the problem. We oftentimes are involved with shaping that conversation around vulnerable populations and community transmission, and so we play an important role in supporting healthcare capacity and also communicating need within the community. So we have a very diverse role in all of this, but key to that role is, I think, our biggest asset to the community is our ability to bring folks together to the table.
Or keep them apart. Social distancing is something that we all are learning, becoming very familiar with, and we're seeing it throughout the city, with our residents, businesses, churches, everywhere. And this is, explain the strategy here. This is a time to buy time, actually, so that the medical community can gear up to the surge.
I would say that it's a double factor, 2 factors here. One is, first, we want to try to slow the spread of the virus. And so by social distancing, the virus is spread through a droplet transmission, which is the person coughs, they cough out what are invisible to the human eye, small droplets that include the virus in it. And so if you're within 6 feet of a person that's coughing and they have coronavirus, it's likely that you can breathe in those droplets, or they may get in your nasal cavity or in your eyes. And so therefore you now have been exposed to the virus. And if you're vulnerable for various reasons, then you may be at risk of getting it. So the more social distancing we have, the less this virus has the place to go and infect humans. So you might have seen on the news where they show the sort of peak, and we're trying to flatten that peak out so that there's less people that are spreading the virus. And at the same time, we are getting ready, but I think the real primary reason is to stop the spread.
So we are getting ready. In your view,
yes,
you have a lot of experience in infectious disease control. do you feel that we are prepared for what is to come?
Feel that I know I can speak for what I'm doing at the Greater New Bedford Health Center. I can only be aware because we prepare for these things all the time. We often don't experience the action that we have to take, but there is a state preparedness and emergency management office at the Department of Public Health. They then work through local health departments and what we call regional health and medical coordinating coalitions. There are 5 of them in the state. We're part of Southeastern Mass. All of our organizations send representatives to them. We do tabletop drills and talk through how we would handle things like this. Damon has actually hosted tabletop drills for just the organizations in the city of New Bedford. We did a measles tabletop, for example, when we started to see measles being spread in the United States, which we hadn't seen in many years. And then sometimes we do actual drills where actors play that they're coming to our organizations or to the hospital, the health center, and they have these conditions, so we can see how we then actually would put that into action. And so here we are now putting our plans into action. I have an emergency preparedness plan. I have a continuity of operations plan, that how do I operate under these conditions where I start to see many patients coming through the doors that are coughing. So I want to not let that coughing expose other people to it. And so we are stopping people at the front door and screening them. Anyone that's coughing, we'll put a mask on right then and there. They may have a cold or the flu because we're in the same season. So this is hard to differentiate without doing testing. But we want to be extra cautious and assume anyone with a cough could potentially be a coronavirus 19 patient. And so we had a call this week with the South Coast St. Luke's Hospital folks about what they're doing. And so we're all in communication. Damon will be hosting. I think he stated that he plays a critical role in bringing us all together so that we all don't go off in different directions.
Which is so important.
What's really clear is we call this the incident command chain of command. So the federal government, CDC, the experts on managing communicable diseases, tells the state departments of health what the actions are that they recommend. They implement, then they work with their health directors, then the health directors bring us all together. So
it's very much like the Office of the Presidency and the Situation Room.
Correct. We have a situation chain of commands, and I have to say, I think of myself in most cases as a very much a consensus building type of boss, but in a situation like this, I run a very tight chain of command.
And that's one thing about this disease. It doesn't discriminate against anyone. We're all in the same boat, and therefore we all really need to come together and work together as a team.
Correct.
If we are to be effective. Let's talk about symptoms, because right now there is fear, there is anxiety. Anytime anyone has any flu-like symptoms, they're going right there on, I might have the virus. And we know that everybody can't be tested for COVID-19. So what are the guidelines when somebody feels they're having symptoms? Well, first of all, what are the symptoms?
So fever, cough, sore throat, shortness of breath. Some people may be sneezing, but that's not a primary symptom of this. So cough primarily and fever are the real biggies. Okay, and then so people that get really sick, shortness of breath, those are the people that need to go and get treated right away.
So now that individual, do they call their primary care? Do they go to urgent care? How would you instruct that person?
So we're instructing anybody that's short of breath, and we can tell by talking, we're instructing them to call us first. Don't just show up, because the more you show up coughing, the more potential for exposure. Makes sense. So unless you're critically ill and feeling severely ill, in those cases we'd say call 911 and go to the emergency room. That's what we want to keep our emergency room clear to do. People that are mildly or moderately ill, talk to your provider. If you're moderately ill, we're going to tell them to come to the health center, see us. Don't go to the emergency room. Clog that up for the people that are severely ill. If you're mildly ill, if coronavirus wasn't around, people would probably think they had the common cold. So stay home, get rest, drink plenty of fluids, take over-the-counter medication to reduce your fever, cough medicine to reduce your cough, and kind of live out your symptoms, and you're probably going to be fine within a few days. So we're really trying to triage people according to the severity of the illness, so we can have room.
So their
in our health
age,
system.
their health, all of those
Correct.
factors. So basically, this fear that many people have around the virus, they really do not have to have that fear at all. Is that what I'm hearing?
Well,
Depending
I would say
on
appropriate caution, right? If they're saying 80% of people will get mild to moderate symptoms,
but they will recover.
but they will recover. But the keeping people out of public places, they are transmitters. Those are the people that are really able to bring that to multiple people. Those are the people that would come to work in a normal situation
Exactly.
if we didn't have these rules in place, and they'd be transmitting it. And then the 20% of people that will get sick are the elderly, people with other chronic diseases, complex medical histories, people with respiratory illnesses are at particular risk to get severe illness.
So the general plan when you are diagnosed with this is quarantine self-quarantine for 14 days.
Yep.
And what does an individual, what do they take?
Well, you take the normal medication you would take for common flu to keep your fever down, to control your symptoms. You would take those normal medications, but again, getting rest, pumping yourself up with plenty of fluids, and trying to keep yourself from your other family members from spreading it is also key as well.
So after the 14 days, would they be tested before they come back into the public?
It depends. And so if you had a confirmed coronavirus, if you're a confirmed case, there's two PCR tests, Cheryl can talk about them, that you're required to take. They have to be more than 24 hours apart. And so you have those two tests, and those two tests would clear you to regain your normal activity in the community.
The CDC is actually every day. One of the things about this that's so fluid and why we create these incident command situations is, my boardroom is just like full of information coming into us. We're gathering that, we're coming together, we're sharing it, because things update on a day by day, sometimes hour by hour. Yesterday and again this morning, the CDC is starting to look at the guidance around when is someone safe to not be communicating it after they're diagnosed. So they're now talking about a certain number of days where you've been symptom-free without any medication, and then you would be safe to go back into your activities of daily living.
And when will we, as a community, will we be able to stop some of the distance, and when will you know that we can start to come back to gathering as we used to?
When the positive tests have gone down or leveled off.
Right.
And so when those numbers, right now we're peaking still.
Yep.
We're at the very, to use a football analogy, we're in the first quarter. And so we're really just figuring out how this disease is going to play out in our community. And each community is different, and it plays out a little bit differently. So the surge will look different in different communities depending on your population. So in Bedford, we have an aging population, so it may play out differently than some other communities that have a much younger population.
We're seeing every day at 4 o'clock the Department of Public Health posts what the new confirmed or suspect cases for the day are, and have been going on every day at around 4 o'clock. And yesterday, I think it increased by 21 cases. The day before was like 34 or 5. Day before that, 33. So as Damon said, we are still seeing this growing. So until we see that level off, we need to be on high alert.
Absolutely. And I think the other thing that causes the anxiety and the frustration is, I think people are comfortable when they have a beginning and they know there's going to be an end. But I think it's the fear of the unknown that has us all a little on edge. And so with this, is there a COVID virus season, like there's a flu season? Is there a time when we can expect that the number of incidences will decrease, or you're less likely to get this?
Well, there's a couple of things that happen that we're looking forward to. Right, number one, we're looking for the weather to change, and so with the weather changing, providing things stay as they are, people get a chance to get away from one another and spread out, and social distancing will will be enhanced with the weather. We're hoping the numbers drop with the warmer weather. And then, presumptively, if January is the D date when this virus kind of hit us, then we're looking at about a year for a vaccine. And so those two things are what we're so we may see another repeat of this in the fall when cold season hits again. But we're just trying to get to this first peak, as Cheryl suggested, trying to level out or flatten out the curve for this first peak, and then we get ready for the fall and see what happens in the fall.
When you have been diagnosed with this virus, are you more likely to get it again?
I don't think we know that, because this is it's not a new virus. The coronavirus is a family of virus, which is why we refer to it as COVID-19. Some people might remember SARS. That's a coronavirus. That was a severe acute respiratory syndrome, which is what SARS stands for. And so this is another virus in that family, and it was typically not causing disease in humans. So this is new, that this virus is causing disease in humans. So we are learning this sort of as we build the system to address it. So there's a lot of things we don't know.
And I would imagine as part of that learning curve, you're also looking at other cities, states, how they're handling it. We all saw what has happened in Italy, and none of us want to live through anything like that. So are there some cities or states that you're looking at that seem to have a handle on this in terms of, or are we all,
I think we're all learning from each other. I think that's the key. I know I'm on a constant sort of, it's an email chain, but it seems almost like a chat room now with the other CEOs of health centers, and talking about all the things they're doing to try to lessen the burden, be ready to take care. So I think for me, I can't read enough information or learn enough about this in order to make sure we can do the best job that we're here to do.
And fast enough. We have a coalition of 14 largest cities that meet pretty frequently. And so we've been meeting and discussing and sharing best practices among ourselves. And so this is new. This is a new frontier. Typically when we have something like this, there's something in the wake to help and support us, and we're just waiting for that vaccine or warm weather to come around. So this is a little bit different.
Right. I think we're learning from China, though. China has started to see a slowing, and so they are slowly easing some of their sheltering in place. I'm not sure what they're calling it over there, or their restrictions around activity. And they lifted it maybe a little too early because they saw a small little peak again. So I think we need to really pay attention to this. But China does seem to be slowing down. Italy, I think, is having a large number of severely ill people, and they're having a capacity issue with ICUs and emergency and critical care equipment, which I think is what we hear a lot on the news media. Not enough ventilators for people with respiratory conditions. Mass General, I think, is just preparing to double the number of ventilators that they have available. So I think we're preparing for the worst of the respiratory symptoms to start coming into our hospitals.
Okay, and so how are we with our hospitals? With the ventilation? Do we have enough equipment?
I don't know what the numbers are, and at this point, as Damon said, we only have 5 cases in Bristol County. So I'm looking at this in my planning with my staff, is that I don't want to go from here to the worst case scenario. I'm trying to build the system with what I know today. So otherwise,
1 step at a time.
You're kind of running frenetically and chasing something that you don't really know what you're chasing. So I want to say, what do we know today? Today we know that if you cough and someone else gets exposed to you, we'll transmit that. So let's try to block that transmission. So masks at the door, temperatures, hand washing, then getting you to your doctor, triaging, getting people in the room, not seeing non-essential patients, rescheduling them, so we're
So that's really what we can do
today
to stop spreading this disease.
Yeah, Yeah, it's social distancing. I mean, we've met with South Coast, and they're working really hard to open up beds that they currently have, and adding new beds to what they, that they didn't have before. And so they're really trying to increase their capacity. The problem is that we got to testing fairly late,
Right.
and so as a result, the testing kind of gives us an opportunity to see the prevalence of disease in the community, and without it, it's hard to plan.
Right.
And so they've ramped up. Federal government has allowed the states to ramp up their testing capabilities, and so Massachusetts has done that as well. They've doubled their capacity to test. And so with the more testing, we get more cases, we get a better outlook on what the disease prevalence is, and then we can plan better. And so right now, we're all gradually planning as best we can for the surge that we think is going to come.
And we also know that knowledge is power, and we want our viewers today to know that there are websites out there where you can get up-to-date, the latest information on COVID-19 virus, because it changes from moment to moment. And so some of your web pages, the City of New Bedford, we're going to get those web pages on the screen, www.newbedford-mass.gov. And when you go on the city's main page, at the top, city offices, you can click on Health Department, and that will take you to the Health Department webpage, and there's a section COVID-19 that you can click on. Same thing with you, Cheryl. The community, your webpage is...
Got me stumped on that one.
Well, I'll tell you, it's gnbchc.org.
Okay.
We'll get that. Also,
try that.
And what I love about your webpage is there are many questions. Many of the questions that all of us have related to the virus, they are on your webpage with answers. You can go there. You can go to Mass DPH, the Mass Department of Public Health. You will find the number of cases by county and the status. And lastly, you can go to cdc.gov, the Center for Disease Control, as well for information. And there's another one that I viewed the other day, which I think is also very helpful, and that's Lawyers for Civil Rights /coronavirus. And you can find information, regular updates on immigration and medical support, food security, employee rights, and more.
Thank you for sharing those sites, because I think the one thing that feeds into the anxiety and fear is not reliable sources. And this is where social media doesn't really do us service. I think it's providing a great service during this social isolation time, but that should not be your source of information of what is happening and what to do for yourself, your family, your loved ones.
Absolutely. For example, toilet paper.
Right.
Why is Damon, please tell me, why is toilet paper a hot commodity right now?
I have 4 women at home. I have no idea, but we have more toilet paper than we have milk. So
you can't find it on the shelves. You can't find it on the shelves, and you didn't tell me that dysentery or diarrhea is a part of this. So
go with this.
I think that's something that social media created. And we're saying that in a joking way, but the reality of all of this, if people just shop the way they normally do, there would be enough for everyone.
Yeah.
And so, people are creating this frenzy that we're going to run out of everything.
Right.
I still can't find Lysol wipes or Clorox wipes. I have been everywhere. They're just not on the shelves.
No.
So that's another message we want the community to know, the hoarding and the selfishness. We really are all in this together, and just shop as you normally shop. And there'll be, I'm hearing that there's no chicken in the supermarket. it's like,
I know, it is crazy.
And
mental health, I think what's important for me is I am now only watching the news twice a day, like a half an hour in the morning to what happened while I slept, so I kind of know what my day might have in store for me. And then I watch it about a half an hour before I have my dinner, which is getting later every night. And then trying to get to sleep, because it really can stoke your fears.
You can become consumed by it. It's true. And I know that there are people that have a lot of time on their hands, and they are just being consumed by this. And so that's why we want you to visit those websites so you can get the real facts related to this. Damon, we're almost out of time. Yep. Is there anything else that you want the community to be aware of?
I did. I wanted to use this time to talk about a couple of our vulnerable populations. One being our long-term care facilities, and then the other being the working establishments, the large businesses that are still open. And so there's some guidance documents and some things that they can do to really help ward off the spread of this disease. For our long-term care facilities, the state has issued some orders and some guidance around how they should operate in the midst of the COVID-19. But I want to reiterate that we as the health department will be enforcing those orders and those guidances going forward. Okay. We're reshifting around our staff to make sure that we have staff that can visit the long-term care facilities and senior facilities, to make sure that they have someone to monitor the visitors that are coming into the space, make sure they have staff to keep the facility clean. We also want to make sure that that the facility is practicing social distancing, and that the programs that they may have had that will congregate folks into a space, large groups, those have been dismissed as well. And so those are some of the things that we want to make sure that the long-term care facilities are doing. And we're trying to create programs where we can provide services, nursing services to their patients or their residents. And so we can get a better understanding of the health conditions of their residents. And then for our working communities, we want to make sure that they also are practicing social distancing. But more importantly, if they have the opportunity for their staff to work remotely, to allow them to do this, to work remotely or from home. We're also asking them to stagger their work schedules, if that's a possibility, to reduce the number of folks that are in one space at one particular time. And then also think about either changing or modifying their sick leave or paid time off schedule, so that staff can take the time that they need to go home, take care of themselves, and get well, and come back and be productive citizens.
Great. And we are doing that at City Hall. And although we are closed to the public, we are taking your emails, your phone calls. We are still there to assist you. We are just about out of time. Cheryl, again, I had said earlier how you have a lot of experience in infectious disease control. Is there some message that you want to leave our community that's listening today? Some words of wisdom you want to share?
As the former commissioner of public health for the state of Massachusetts, we have one of the best health departments, if not the best. I would say we have the best health department in the United States of America. We have the best academic health institutions here. We have an incredible director of public health here in the city of New Bedford, a committed South Coast Health, and a very passionate, committed staff at the Greater New Bedford Health Center. So a lot of smart people thinking about this, working on it, committed and dedicated to keeping us all safe and cared for during these very challenging times. So
we're in good hands. We're in good hands. And that's a great place to leave the show on. So to you, our viewers today, stay encouraged, stay informed. We are in this together, and we will get beyond this together. Thank you for watching today, and we will see you next time on Neighborhood Update.
Thank you.